Oh, hey, hang on
Everybody, my
before.
name's
Oh,
Joanne.
okay. Oh, hang on. I actually, Joanne, just give me like 30 seconds just to do my little spiel, if you don't mind. Just.
Oh, yeah, of course, no problem.
No, no worries. Just so we kind of get it started formally. So thank you, Justin, for starting the record. So I want to welcome everyone to today's Lunch and Learn session. This is actually our second to last Lunch and Learn for 2021. We do have another Lunch and Learn scheduled for the third Friday of August. That is going to be from 12 to 1. That's actually, we're going to give 1 hour to Alan Booker, who is the economic minority planner in the city of Niagara Falls. They're going to talk about economic development and opportunities for minorities within the city. So he had requested a full hour presentation. So that's going to be our last Lunch and Learn for 2021. Not to fret, though, we will be continuing this again in 2022. So we think this has been a very successful series. And we just want to thank all of the participants. So that's our next Lunch and Learn. Also, if you want to share with your consumers, our next Coffee Clatch, we reinstituted the Coffee Clatch, which is a social meetup for LGBTQ individuals throughout Niagara County. Our next one is on Saturday, July 24th at 11 a.m. to 1 p.m. And we're going to be meeting at Power City Eatery in Niagara Falls. We just had our first Coffee Clatch last week, and that was actually in North Tonawanda. So the Coffee Clatch will alternate locations. We're going to have one in Lockport in whatever that Sunday is in August. It's not coming to me right now, but we'll be alternating between Lockport, NT, and Niagara Falls. So we'll have those posted on our Facebook site. And then the only other thing I wanted to introduce or mention is that we are doing our backpack drive. We had done it last year. We're going to be doing a backpack drive and school supply drive to benefit LGBTQ students throughout Niagara and Erie County, students who are part of various GSAs or have the schools have identified that are in need. We're going to be collecting donations. On our Facebook site, we will post the location drop-offs, dates, and times, but we're going to post that on August 1st. The committee that's meeting to decide the events, times, and dates and stuff like that, we're going to be meeting this Sunday, so we don't have that information yet. So on August 1st, if you just hop onto our Facebook site, you'll see a post. We will have all of the various drop-off locations, dates, and times for where people can donate school supplies. And so without any further ado, I would like to introduce, in order of presentation, Joanne from Fidelis. We will do then Jill from the VA's, from the Department of Veterans Affairs, but the LGBTQ Health Program, and then Tara from the Mental Health Association of Niagara County. So with that, Joanne, if you would like to tell us about Fidelis.
Thank you, Ron. And I do want to say a special thank you, Ron, for including us and seeking us out as a sponsorship for the recent Shopping with Pride campaign. We had so much fun, and I can't wait until next June. It was just a blast to follow everybody around on June 1st with those flag raisings. It's something that we're super proud to be a part of. And I should add that our parent company, Fidelis here, is a subsidiary of Centene Corporation. It's a larger corporation based out of St. Louis that manages health plans throughout the country. We were just notified that for 2020, we've been recognized by the Human Rights Campaign Foundation as a stellar place to work. So we're very proud of that and do a lot of, thank you, a lot of deep work in our diversity and inclusion programs that we have through the corporation. I belong to a couple of those groups myself, the group for women and the group for folks with disabilities. But we have an LGBTQ group at Centene called see Pride, that is now garnering, drum roll, over 2,000 members. And we're so excited to have,
Awesome.
yeah, these side programs for people who work for us, to feel heard and validated is so important, because we're serving folks who need to feel that. So why wouldn't we also need to feel that too? So just wanted to throw that out there. If I can share what, am I going to be able to pull this up here? If I share my screen? Okay, let's see. Where am I? This is what I want. Can everybody see this Health and Fidelis Care Healthier Life flyer? No? Can everybody see this now? Okay. Healthier Life is a program of Fidelis Care for folks who are struggling with a mental health or substance abuse diagnosis. The Health and Recovery Plan was brought about by New York State several years ago to assist folks in getting enhanced benefits under their already amazing Medicaid benefits, but enhanced to support their true needs. So every person that is eligible for HARP and joins HARP is assigned a care manager, and they help to develop a plan for these members that gets them coordinated, helps them figure out what physical health they need, their behavioral health, and their overall well-being, whether that means helping them find housing or extra supports in the community. We're certainly able to support them with that. And by example, our relationship with Niagara Pride. So we have members that may come to us and say, I'm feeling some kind of way, and I really need a group or a person to talk to. We would absolutely refer them to Niagara Pride. So it's just one of those benefits that they have. Allows them, if they're already living independently, allows them to seek that independence, even through their diagnosis. So we find this a really remarkable plan. Let's see. I am so off the list. I should be amazed by now, but I'm just not. Here we go. Okay. So getting to know our health plan. This is a lengthy presentation. I'm not going to read this word for word. Folks might already be familiar with Fidelis Care and who we are as a quality and mission-driven company who just seek to find the folks that need us the most. Fidelis got our start back in 1993 under the auspices of the Catholic Medical Center in Brooklyn. We carried one plan in one zip code back then, and now we are in all 62 counties of New York State, offering programs for all ages and all stages of life. Let me see here. Oh, it's already there. Look, I read that and I didn't even know it was there. 80,000 plus primary care providers, specialists, and hospitals in our statewide provider network. We have over 4,000 employees just that work for Fidelis in New York State. We did join the Centene family of health plans back in 2018. It actually gives us a greater scope of what we can cover and who we can cover and where we can cover. We're committed to serving our communities through partnerships with local providers, schools, and community organizations, just like the partnership we have with Niagara Pride. We find ourselves very culturally diverse, and we have a bunch of staff that are bilingual and multilingual to help folks enroll into the communities that they live in. Very important for us to have that. So for the bulk of what we need are Spanish and Russian speaking representatives in this region. We've really gone outside those languages very often. It is important to us to address the social determinants of health, and many factors contribute towards someone's wellness. As we've discovered over the years, this is not new to us at Fidelis, but it is something that's, I don't want to say trending, but kind of is trending to pay attention to what socioeconomic conditions exist in communities to help folks breach that barrier and access the care that they need and deserve. Our representatives are in every community across New York State, and so hopefully folks know we're available. Our product line starts with Medicaid managed care. It is what we started on. It's from our grassroots beginning all the way back in 1993. Medicaid managed care was developed by New York State because they discovered that folks who were just on straight Medicaid weren't getting the services they need. And mostly because there weren't doctors who were just taking Medicaid. They didn't want to take straight Medicaid because it didn't pay very much and it didn't pay on time. So the state developed managed care plans through plans like ours to partner with the state and say, we'll take care, we'll manage this client's care, and hopefully build a efficient network that is reliable and trustworthy, which we have done. So Medicaid managed care covers folks' regular checkups, preventive care, routine screenings, emergency care, dental, vision, and so much more. There's literally not a better coverage on the planet. Healthier Life, which I just went over, is our health and recovery plan, provides folks who are eligible for Medicaid, and they have to be 21 and over, who have specific behavioral health needs with an enhanced benefit package. So I'm very proud to offer that. The qualified health plans are part of the New York State of Health marketplace. So qualified health plans are available with different levels, different designs, depending on what county you live in across New York, but they are available in all counties. A special enrollment period is currently underway with that. Normally, qualified health plans open enrollment is only from November to January. Since COVID hit last year, it kept getting extended. Governor Cuomo said, forget it, we're just extending open enrollment for the rest of 2021. So there is no special enrollment this year. It's open for the entire year. The Essential Plan is part of the Qualified Health Plan development. So that came about a few years after the Affordable Care Act was passed. And New York State discovered that there were still folks falling in the cracks. So folks who were not eligible for Medicaid, but couldn't quite afford a plan through the Qualified Health Plan program were eligible for the Essential Plan, which offers comprehensive coverage with very low out-of-pocket costs. And the highest premium on that is $20 a month. So it is super, super affordable. Next in the lineup is Child Health Plus. I'm certain everyone's heard of this. I personally call it the biggest no-brainer in health insurance history because it literally covers every child that is eligible for it. The only children in New York State that are not eligible for Child Health Plus are those whose parents work for the state. So and I'm going to send out, I'll send Ron the Child Health Plus income guideline, and it will show you, based on household size and income, is how children's eligibility is determined, or how much a family may have to pay for coverage. Most families in this region aren't paying more than $15 or $30 a month premium on that Child Health Plus, and it covers everything, and never a copay, which is huge. Because if you have a family with 3 kids, one gets sick, they're all getting sick. So if you have a regular HMO with a $30 copay, you're looking at $90 copay. Child Health Plus doesn't have any copays. Next up is Fidelis Care at Home, which is our managed long-term care product, and that is also available in all 62 counties. This benefit is for folks who are looking at long-term care services or nursing home type care services. And they're designed to help people stay in their homes instead of going into an institutional setting. Medicare Advantage and Dual Advantage programs are also available through Fidelis Care, as well as Medicaid Advantage Plus, which is a special Medicare plan designed for people with special healthcare needs. Let me see here. Whoop, went too fast. Apology. Here we go. So obviously we're all here to help explain health insurance options and benefits. One size does not fit all. As we're aware, we do have competitors out there. There are other plans that offer managed care through Medicaid, other plans that offer Child Health Plus, and we're going to enroll folks into the plan that works best for them. That may, the reasons behind that may be providers, it may be where they live and how they can access services. So a lot of things go into how we determine what's best for folks. We can assist with enrollments or renewals right over the phone. No need for a face-to-face interview unless that's wanted by the client, then we can certainly do that for them. We are going to guide members through the payment process as well. For those folks that do need to pay a premium, it's a very simple little click of a button or the mouse on our website can set up automatic payments. We explain terms such as co-pays, cost sharing, co-deductibles. Some of that stuff just confuses folks, including myself sometimes, and I've been in this business for close to 30 years. So we do take time to explain what things mean. And obviously we're here to answer questions and provide local resources. We find ourselves as a plethora of information because we get to meet and know so many other people in nonprofit that we pretty much know where to send folks if they're needing help with mental health or they're needing help with housing or whatever the case may be. Our member services support line and member portal can be reached 24 hours a day, 7 days a week. Other resources for members are case management. So folks that suffer from chronic illness like diabetes or autoimmune disorder get to choose a case manager to support them throughout their illness, keeping track with how things are going, if their medicine is working, and if not, what can we try next? What kind of avenues can we take to get this member the best care they can get? We have a baby care program that provides support throughout pregnancy and the birth of the baby. It is exclusive to Fidelis. No other plans provide that for pregnant mamas. Smoking cessation programs. Members have access to free therapy to help them quit the cigs. We certainly promote that at every opportunity. And we do carry a member newsletter that is available quarterly and helps cover health topics for folks that are interested. Well, here we go. You can find a doctor if you're a member of Fidelis and you don't have a doctor, or you're looking for a specialist to go to, or vision care provider, dental care provider. You can find that information on our website. You go to the homepage of fideliscare.org, and at the very bottom, click on Find a Doctor. You're able to fill in the information, like zip code or what kind of physician I'm looking for. Maybe I'm looking for an orthopedic or vision care provider. We can plug that in and up pops a number of possibilities for our members. We took great care in supporting our members and our partners throughout the COVID-19 pandemic. We're hopeful that the worst of it is behind us. But to support members' health and access to care, we waived all cost sharing related COVID-19 screening, testing, and treatment, including co-pays, co-insurance, and deductibles, as well as in-network outpatient mental health services. So that was all covered. It continues to be covered. We are continuing to expand our access to telehealth services as well, which we found during COVID were very important to have. I myself have a telehealth appointment every month, so I appreciate not having to drive into Cheektowaga from Wilson to go to that. We did offer telehealth services with a $0 cost sharing. Members can use that benefit from the safety, comfort, and convenience of their own home by scheduling a telehealth visit with our network primary care provider or specialist. And that is if those providers offer that service, but we have not heard any that don't. So that's a great extra benefit. The online community office. Some of our community offices were temporarily closed over the pandemic. So this is kind of outdated. We are open in Buffalo. Our community office in Buffalo is open. So you can visit that at any time. If you have members that need help and live in the city of Buffalo, you can send them straight to us at Main Street. Right by, where are we on Main Street? I should have had that information. I'll email it to Ron also. But our team is available by phone at 1-888-Fidelis any day, anytime. We can take information from folks and get them in touch with someone that can help them. This last slide is just my name and phone number. If you guys ever come across clients or friends or neighbors that need help or have questions, I'm always only a phone call away. Can certainly help folks capture the things that they need for health insurance. So is there any questions out there for me? I know it was a lot of information. I didn't know if you guys also knew that we have a mascot. Hold on a second. His name is Fidelis. He's a really cool and nice dinosaur. He comes to events. I have an amazing representative, Jamie Tucker, who covers the North Tonawanda district for me. And he is always my go-to guy to wear the mascot suit. So if you have something fun where there's children going to be there and you need just a distraction for them, the Fidelis comes in giant life-size model. He's always available to do that. As well as any events. Yes. He is so friendly. Yeah, he's a hugger, so watch out. If there are any events that you think would benefit to have us there, we're always available to do events. If you're looking for sponsorships, we can certainly look at that. Any collaborations or campaigns and initiatives that you have going, I love to collaborate with folks. I think it's very important that we learn what we all do so that we have a better understanding for the members that we serve. So, any questions for me?
Nope. Nope. And Joanne,
I really appreciate your time.
No worries. I was going to say, Joanne, we have your contact information, which we can share with the rest of the group. So if people do have questions, we can share your info so that they can get in contact with you.
Thank you. I really appreciate it. I hope everyone has an amazing weekend. Stay dry, stay hydrated, but stay dry.
Definitely. Thank you so much, Joanne.
Thank you. So sorry I got to hop off. Thanks, guys.
No problem. So, all right. So next, I believe it's Jill. So Jill, if you don't mind talking about the VA's LGBTQ health program.
Sure. Can you see my screen, my PowerPoint?
Yes, we can.
Okay. Just to let everybody know, I am having some technical difficulties, so everyone's pictures are just black. So if you have questions, please don't raise your hand because I can't see you. So, all right. So basically, my name is Jill Biger. I until recently, I was the LGBT Veteran Care Coordinator, also the LGBT EEO Special Emphasis Program Manager. Due to my new role as a Caregiver Support Coordinator, I no longer had the time to fully invest to this program. So I did hand it off to some different staff. So the news, well, first of all, this is just something I love to throw in for a conference call bingo, because we've been on so many conference calls in the last 13 months. So something to kind of keep and use in all of your conference calls, and please feel free to use it today. So the new LGBTQ plus contacts for the VA are Tim Ward, who is now the EEO Special Emphasis Program Manager. And then we have 2 veteran care coordinators. We have Kaylee Tompkins Lipsitz and Angelica Cuthbert. The differences being is that Tim will deal with any LGBTQ plus related issues with employees and employers, whereas Kaylee and Angelica will work with LGBT veterans. They do tend to overlap at times because a lot of our employees are also veterans. So they will work together in that capacity. So the LGBT health program at the VA, traditionally the VA has a pretty bad rap as far as LGBT treatment because of our affiliation with the Department of Defense and just military standards throughout history. So to look at that, in 2012, the health program was created to provide some policy regulations and to really sort of change the face of the VA within the LGBTQ community. And as part of that, every health center across the country was tasked with creating this role of a veteran care coordinator. So this role is an auxiliary role. It's attached to whatever our other role is. As far as the Department of Defense goes, the Department of Defense is very separate from the Veterans Administration, and the DoD has had numerous laws and policies in relation to LGBT individuals serving. The VA, however, has never had any such policy. Currently, things have been getting better. Currently, LGBTQ veteran or service people are encouraged to serve openly, and there's no formal restrictions based on anything currently. So as far as LGBT policy within the VA, right now we have specific directives for LGB individuals and then another directive for transgender individuals that have been in place since about first is 2011 and then 2017. Very recently, it did come down that the VA is now looking at providing gender confirming surgeries for transgender veterans. So that's a huge change and a huge positive change that's been established. Unfortunately, it is probably going to take about 2 years for a full policy to put into play. We also do have a sexual orientation and gender identity policy for employees. It's a non-discriminatory policy, so that no employee can be discriminated on due to sexual orientation, gender identity, or expression. Also tolerates no discrimination whatsoever. This is part of the policy for veterans that identify as lesbian, gay, or bisexual, that we'll provide them with appropriate, comprehensive, and veteran-centered care, including assessments of sexual health. This directive also solidified that no provider within the VA, no mental health provider or psychiatrist, could either offer or provide conversion therapy. That is strictly outlawed. The transgender policy is a little broader. It did lump transgender individuals and intersex individuals under the same policy, but it basically encourages staff to respect what a person, when a person says that they prefer to be called by a different gender, or they prefer to be called by a different name, that is respected regardless of how the veteran presents. So if a veteran presents physically looking very male, wearing male clothes, but requests that female pronouns are used and a female name is used, the VA staff do have to follow that, okay? And because we also kind of recognize that transgender individuals can present to us in any state as far as their transition. So they could be pre-transition, they could be, during transition. Some are pre-op, some are post-op, some prefer not to have any surgery at all. So we'll be respectful of their preferred name and preferred pronouns at all times. Transgendered veterans are welcome to use a bathroom of their choice. Unfortunately, in my tenure with the LGBT program, I wasn't able to establish a gender neutral bathroom, but typically I've actually never heard of any problems associated with a transgender person using the bathroom of their choice. Room assignments also has sometimes been an issue. Basically, if we have 2 people in a room, in an inpatient room, if we have a transgender person and we have a cisgender person, if the cisgender person is uncomfortable in sharing a room with a transgender person, the cisgender person is the one that gets moved, okay? So we will room a person according to their gender identity. We do have a wide array of transgender medical services. And we do follow closely with the WPATH standard of care, which is the World Professional Association of Transgender Health. So some of the care that we provide specifically for our transgender veterans, we provide mental health care, and that includes mental health referrals for any letters that an individual might need for any gender confirming surgeries. We do provide at the VA a cross-sex hormone therapy or a gender confirming hormone therapy. Typically with that therapy, the endocrinologist requests just a psychosocial evaluation of the veteran prior to referring for the endocrine. It's a very simple evaluation. We will assist with pre-operative evaluations. So if they need any sort of clearances from any specialists, if they need labs, if they need any additional testing pre-operation for gender confirming surgery, we will provide that. We will also provide any post-operative care and long-term care if there are any outstanding complications associated with their surgery. We also provide prosthetic devices and speech therapy. Currently in Buffalo, our speech therapists are not trained in transgender speech therapy, but our community care will provide it. So the VA will pay for someone to go to a speech therapist in the community for that service. And then under some conditions, laser hair removal is available, and there's some reproductive assistive care as well. The reproductive care is constantly changing, so I didn't provide much information on it because it's changed so many times. So some of the prosthetics that the VA will pay for and provide is pretty extensive, honestly. We have wigs, packers for trans males, stand-to-pee devices for trans males, gaffs, chest binders, surgical compression vests, breast forms, and vaginal dilators. So it's been pretty easy for our providers to order those prosthetic consults. So currently, again, the VA does not provide gender confirming surgeries. We also will not pay for gender confirming surgeries on the outside. That will hopefully change within the next 2 years. In some situations, transgender individuals can get surgery through the VA if it's related to a medical issue. So for example, if a trans male still has breasts and has breast cancer, the VA will cover the mastectomy. Okay, so in those types of situations, it would be covered. But as the VA medical package, because VA is not an insurance, it is a medical package that is fulfilled traditionally through the VA system. In that package, plastic surgery is not covered. So any sort of cosmetic type surgery is not covered. Anything that's not medically, not medically necessary. So unfortunately, the powers that be for many, many years did say that gender confirming surgery is not medically necessary. We do know that's not true. It is very medically necessary, and hopefully now it's going to be moving forward to get completely covered. So just some resources, some of the websites for the LGBT veteran care. Please note, I do have LGBT here. We very, very recently, like in the last 2 weeks, changed the name of the health program from just LGBT to LGBTQ+. So we're very pleased about that. There's also a website for our diversity and inclusion, patient care services, this self-identified gender identity. This is a means that a transgender individual can enroll in the VA system with their preferred name and preferred gender. And then some information from the World Association for Transgender Health. So thank you very much, Ron, and everyone else for your time. Are there any questions?
I just have one question because I'm not sure how many people may know this, but since I also work for the VA, I think I know this. I'm going to ask Jill. So I think most people are aware of the large medical facility on Bailey Avenue. That's the primary location. Technically, it's the VA Western New York healthcare system, so it's combined with Canandaigua.
No.
And Canandaigua is not part of the Western New York.
We are Buffalo, Batavia, and then we have our community outpatient clinics in Lockport, Niagara Falls, West Seneca, Olean, Jamestown. I think that's it. Canandaigua is under our Finger Lakes.
Wellsville? Do you still have a clinic in Wellsville?
No.
No, okay.
There may be one there, but that's not under us. We used to have one in Warsaw.
Yes. Well, Warsaw, I think
that
was
one's not there anymore.
Okay. So, all right. Well, since I don't work for the hospital, so things change, but I thought Canandaigua was still part of Western New York. But that was going to the crux of my question was, I think most people are just maybe aware of the primary physical hospital on Bailey, but there are a number of clinics throughout the community. So especially here in Niagara County, as you indicated, Joe, we've got Lockport, Niagara Falls, nothing in North Tonawanda, but
nope, just those two. Those two. Yeah. Okay. Yeah, we cover a wide area. Definitely, we cover a wide area. So yeah.
Very cool. And all of the things that you mentioned, even though not all the services may be at the outpatient clinics, but veterans can still get that LGBT affirming level of care, whether or not all the physical services are at an outpatient clinic, like if that makes sense.
Correct, absolutely. So when I took the role as the LGBT veteran care coordinator in 2017, I believe it was, one of the first things that I did was travel to all of our community outpatient clinics to meet with staff, to introduce myself, to provide them some information, and just kind of the reminder of, veteran-centered care as far as LGBT services go. And I've gotten calls and emails from all of the clinics with questions, concerns, and things of that nature. And much like any referral system, I mean, we do have behavioral health right at all the community outpatient clinics to do those evaluations. But for things like endocrine, they do need to come into the city for that.
Right. So, all right. Very cool. So thank you, Jill. Thank you for that. Yep. No problem. And last, but definitely not least, Tara from the Mental Health Association of Niagara County.
Hi, everybody. So I'm Tara Porter, and I am the director for Compeer Niagara, which is a social inclusion program of the Mental Health Association in Niagara County. I wanted to just give some information as far as what programming we provide for here at the Mental Health Association, and give that contact information and everything else so that if people want to become a part of what we offer, you can. So the first thing is the programs we offer are all supportive programs. We work alongside other providers. So we are not clinicians. Again, it is supportive programming. So we have an information and referral programming, which really tries to ensure that people who are in the community can get linked with the services they need without necessarily going through care management, although we do refer to care management quite a bit. We also have people who go out into schools and provide presentations on anything that has to do with mental wellness, because that's our goal, is for everyone to feel good. We have the library that we have here in the office. It focuses on mental wellness. So we do have those topics of, mental illness, mental diagnoses, that kind of thing. But we also have just, fiction to enjoy. We have puzzles to enjoy, because again, we are all about improving everyone's quality of life through every day-to-day things. So that is kind of what our information and referral programs do. We have, and the community education piece, as far as going to health fairs and being able to present on mental wellness topics and things like that. We have peer and consumer services. So what's pretty great about that is we have a bunch of staff who are considered peer advocates, who have gone through the training, who have personal experience within navigating the mental health system. And so their job is to help others navigate the system. And it looks different, very person-centered. So some people could be coming out of the hospital, others could be in the community and just need one of those things where they're like, I really need someone to come to this doctor's appointment with me because I'm not really sure how to advocate for myself at this one. So again, it's peers supporting peers. We have, part of that is also the CPAC programming. So with CPAC, it's people from the community who are receiving services and feel like there needs to be some change within those services. So there's monthly meetings where they can get together and talk about the changes that they'd like to have made within their community and how to take action on that. The other things that they do are the self-help and support groups. So we actually have a depression and anxiety support group. We have a grief group. We have a peer support group. The CPAC group, the Consumer Planning Advisory and Council that I mentioned. And then we also have the LGBTQ plus support groups. So those happen at 5:30 on the first and third Thursday of every month. And those happen here at the Mental Health Association in Niagara County office, which is at 36 Pine Street in Lockport. We have a respite program too. So it's in-home respite. So what's great about that is that it provides free childcare for families who have a child, at least one child in the family with a mental health diagnosis. So our staff will go and essentially, babysit for a few hours so that the care provider can get that respite that they need in order to be their best self. So you can, go out, say you want to go wander around Target and look at all the shiny things while your kids are home playing, you can do that. Or if you want to lock yourself in the room and binge watch Netflix, you can do that. Or if you're one kiddo you feel like hasn't gotten a lot of attention, you can take them out for ice cream while the other kids stay home with the staff. So that's a really great opportunity as well. That's a self-referral and free. All the support groups are self-referrals and free. Community education, you can reach out to them. We do have some trainings that are offered with that require payment, but there's also plenty of other free options with that as well. And then finally, I do Compare Niagara, which of course is my favorite. So again, we're a social inclusion group, and we're all about improving everybody's quality of life through friendship and getting out into the community. So I work with youth, which are ages 5 to 17. And then I also work with adults that are ages 18 to, I think my oldest one right now, maybe 87. So I serve everybody who's in Niagara County, and we go throughout Niagara County, checking out our community and trying to just enjoy. Last night we had a event. We went up to see the baseball game at the Niagara Falls Stadium there. It was a really great time. There was, a 47-year-old person who it was their first baseball game. So it was really, really exciting. We also had the kids there. There was a lot of first-time baseball watching kids there too. So it's a really good time. We are offering a lot of things right now. We offer a program that's called The Couch. So that's for teens and tweens. They can come here to the office on Wednesday evenings. And what I did was I made one of the offices into just kind of looks like a living room. There's a couch in there, a TV in there, really cool artwork, dry erase board that gets tons of action. And it's just a safe, clean, supervised space where kids can come and hang out and be themselves and not have to necessarily feel the pressure of hosting or the pressures of having a guardian be supervising. So it works out really well. I actually spoke with Ron earlier. We are hoping to connect as far as what we've seen as a large trend within my programming, especially, is with the teens and tweens, really trying to navigate gender identity, sexuality, things like that, and also trying to navigate it for themselves, but also with their care providers. They've found that service providers tend to be much more accepting and much more supportive than maybe those that are in their natural support system. So we are really doing our best to support those individuals. It actually led to a huge update in our office library, just because, as everybody knows, information and the standards are, constantly improving, which is wonderful. So we updated our tools when it came to that. So that's kind of where our focus is going towards when it comes with the LGBTQ plus community. We are focusing on that support group. We're focusing on providing the supports and the referrals when it comes to individuals in our other programming, because again, the Mental Health Association is for everyone. It's all about mental wellness, and everyone has mental health, and everybody needs mental wellness. So it just kind of covers everything in that sense. But that's where we're really focusing as far as the LGBTQ plus community members. And we just doing simple things we found has really made a difference. Hanging the pride flag, just it we just hung it in the reception area, and it completely changed the tone for some people who were coming in. They just feel so much more comfortable. We were able to get a bunch of the postcards that said, you know, this is a safe zone. You know, you feel free to be yourself and talk about whatever we need to talk about. And the kids especially, you know, they see that safe zone card on my office door and they're like, okay, I'm coming in. And that's when they want to talk. So we found that those very small things are making a huge difference. So we're really excited. I know I am, especially to be able to link up with Ron in the future, because I can only imagine with those small things making such a difference, what larger things will do. We ordered some books from Amazon that were highly rated. They were set up as like the comic book style type thing. And that's how one of our youth was able to let her parents know that she is exploring her identity. And just small things like that we found are really making people feel healthy and supported, and that's what we want to continue to do. So that's kind of the overall gist of the MHA. I'm always looking for volunteers to be a part of the Compare Niagara program. So if you're interested in a really, really flexible opportunity, and our success is measured on enjoyment. So it's a fun time. If you're not enjoying it, we're doing something wrong. So if you ever want to look into being a volunteer, there's always that option. All of our information is available on our website. That's www.mhanc.com. So Mental Health Association Niagara County.com. And our phone number is 716-433-3780. We are here Monday through Friday, 8:30 to 4. People can call and ask any questions they may have as far as where they could go for resources, what we could offer them specifically. And we have the Facebook page and all that great social media stuff as well. So you can look for us on there too.
Awesome. Thank you so much, Tara. If you're able to, in the chat, if you don't mind, Tara, throwing in your contact information, that way I'll have your email address that way if you can do that. And to Tara's point, I do just want to say, given my day job as the EEO program manager at the VA, and I'm sure possibly Jill and Mark can probably shake their head. Yes, Justin, probably in your company as well. But the idea that if all you see are posters and promotional items and magazines and brochures that only show white males and not the full spectrum of people with disabilities or Black individuals or Hispanic individuals or an LGBT couple, you begin to kind of question, well, who does this agency serve? Because clearly that's all we see in every one of your marketing materials,
Right.
is one type of clientele.
Absolutely.
So those little things do actually matter, and you do notice it. So that is a very, very true statement, Tara, that I'm not surprised that it makes a difference when you start seeing that stuff. So thank you for bringing that up. Unless anybody has any questions for Tara or Jill, going once. I see Mark shaking his head no, so I'm guessing no questions for today. I just want to thank all of our presenters. I definitely want to thank Joanne, who's not on the call anymore. She had to leave early, but Joanne from Fidelis, Jill from the VA's, let me get it correct, the VA Western New York Healthcare System LGBTQ plus program, which is a mouthful, and also from Tara from the Mental Health Association / Compeer. So thank you all for joining us. Very excited that you were part of today's presentation. And again, if you can join us for next month, feel free to join us for that call. And I look forward to working actually with all of you in the future on different projects and working with Niagara Pride and your different organizations for different things as well. So thank you for coming to today's Lunch and Learn series.